Here. All right. Okay. Change. So let's do a little bit of housekeeping this morning. We do have assistance on accessibility and language. I want to double check with our OHA team if that is available just yet, because I know we were waiting for them in our wait room and they hadn't arrived yet. So can somebody give me an update on whether those options are available to us just as yet?
Hi everyone. This is Carrie Christensen. Right now, we only have the option for captions, and you can access that by going to your three dots more and then turning captions on at your individual computer. But we are hopeful that we will have a Spanish language captioner and interpreter joining us. I'll let you know new as soon as I know.
Perfect. Thank you, Carrie. Great. So for those who are interested, as Carrie mentioned, we have the real-time captions and transcriptions available. So go ahead and click on those three dots and get that situated for yourselves. Also, we do have a lot of helpers in our session today. So if you are needing some additional tech questions, go ahead and reach out to both Carrie or Tamby in the private messaging section of Zoom. You can do that through the chat function. So they're available to help you today. We do have other folks helping us today. And just for visual cues, for those of us who have our GRASS backgrounds on, we're going to be facilitating those discussions in the breakout rooms. So we have a team of outside facilitators outside of OHA who are helping us today and really helping lead those conversations in our breakout rooms. And so really excited to have them. So those folks have that green background similar to myself. And then we have our tech team and OHA team who have the space background, similar to what Carrie has on her background. So reach out to any of those folks if hopefully those visual cues are helpful to you folks. I also want to share that there's going to be a lot of information in the initial presentation that I have for you. And so for those folks who need more time to sit with some of that material, I encourage you to look at the FAB website. So FAB, again, standing for Public Health Advisory Board. So that link is right there on the page. And then in the materials that we send to you, you can get that link as well. So all the detailed pieces of what I'm sharing are available to you there. I will tell you up front, I'm going to kind of move swiftly through that material so that we can get to the chunk of our time. We only have an hour today, so most of our time will be spent in your breakout rooms in discussion with our facilitators. And so I want to make sure that that time is reserved. So let's go ahead and get started. Again, welcome everyone. This is a special opportunity for us to come together. What we're doing today is really bringing together community-based organizations, our local public health authorities, our state public health workforce, academic partners and tribal partners. And what we're going to do is really have an extended conversation about workforce in our state and what it looks like. And so what you can expect from this session today, is that all the conversations that we're having, we've been working on that as part of the public health workforce work group. Okay, again, a mouthful, right? We'll have specific facilitators who will also be doing the note taking, and we'll have two main questions for folks today. Part of the work that we're going to be doing today is really adding to giving the public health, the FAB, the Public Health Advisory Board, additional information on what you all see as needed for our workforce in Oregon. Anything that you share is going to be anonymous today, so we're not trying to connect it to any specific person. So keep that in mind. We do encourage you to share openly. So again, to give you a little bit of background about this particular work, the FAB and the workforce work group, the FAB really is the advisory board that, works and connects with the Oregon Health Authority and offers, additional support and advises them on policy, public health issues, statewide initiatives, things like that. And then for the workforce group is a very specific subcommittee, if you will, working on what does our current system look like? And so they've been working on this as part of public health modernization for some time now. And we're at the point in our work that we're really reaching out to community for more input. Again, more specifics. This is all part of public health modernization. And what we're going to do today is really take all that information and summarize it and offer that back to the FAB, the Public Health Advisory Board, later in the year, specifically by the end of the year. I want to also offer to you kind of where the project has, where we're at in that process. So phase one, from the beginning of the year till about May, June, we really worked with an outside consultant, YSAC they're called, and they did a lot of research on information that Oregon already has. So there's a lot of different uh, you know, literature review, work group information that they already had. So they kind of consolidated all of that for the FAB work group. And then now we're at the phase two, where we're really collecting and offering community engagement as part of the feedback. And so this is where you all come in as partners, and specifically your different areas and arenas that you work in public health. And so as we gather your information, we're going to do a little more gathering in September, and then kind of come up with draft recommendations for the FAB towards, fall. That's our fall work. And then we'll offer that at the end of the year in December. And then from December on, the approval process will be taking place. FAB will take in those recommendations and move towards a plan for the future. Again, this is kind of some of those process pieces that we've been working on, that analysis, the work groups coming together and trying to decipher what else we're going to do, and what additional information we may or may not need, right? I do want to mention that the work groups really kind of went back and to focus on those foundational capabilities within public health. And we'll take a quick peek at that and see what, that is. I mention it, but I want to also encourage folks in your discussions to not worry about having to categorize each of those capabilities in your thinking of like what the workforce really needs. So a couple quick grounding slides. We're meeting at the waypoint is what we're calling it, and that is, here are those foundational capabilities, right? So if we're thinking about public health, we're thinking about good modernization, has these 7 elements in it: communication, policy, leadership, health equity, community partnerships, emergency preparedness, and then assessment and epidemiology. So those are very specific areas that, we want to make sure that our public health system have these up and running and are strong in these areas. And so as part of that conversation, we're encouraging you folks to, again, while keeping that in mind, things will bubble up for you naturally when the questions that we have for you that we're going to focus on in our breakout rooms, those will come up, and you can kind of keep this in mind in the back of your head. All right. So what are we going to do during this time today? We're really plotting the direction. So these are the needs and the gaps that have been identified as the priorities for public health workforce. So the question is, we want to ask you folks to help us guide us to that destination, right? So the two questions in your breakout rooms are going to be, what are the biggest challenges or obstacles preventing our public health workforce from effectively doing their jobs and meeting community needs? Now you can distill that down to something a lot more simple, as like, what do you feel are the biggest challenges? What do you feel are some of the obstacles, right? And then incorporate those other pieces of community in our workforce. The second question that we have for you today, and our facilitators will repeat this as well. The second question that we have for you folks today is, what specific resources or supports do you need, right? What's going to help strengthen our public health workforce and improve public health outcomes? So those are our two challenging questions for plotting our direction. I want to give you a little direction on how we're going to use our 30 minutes of our breakout time. What we'll do is I'm going to ask you to choose a breakout room that best reflects your public health community. So where you work in public health. So we have several different categories. We have academics and our educational partners. We have tribal partners, community-based organizations, local public health, and then state public health or a public health authority. And then we have another category, what we're calling unicorns. So if you don't feel like you kind of fit in any of those, unicorns are going to have a special breakout session with myself. And then if you also need a Spanish language interpretation, I'm going to encourage you to choose the unicorn um, breakout room as well. Okay. So again, I encourage you to choose a room that is 12 people or less, if you can figure that out. And then each room does have a facilitator. They're going to guide us through those questions again. And then we're going to do that for 30 minutes and then come back and then do a quick next steps on where we're taking all of this information. All right. And I believe we have our categories in our breakout rooms all set up. And I'm going to look to Carrie and say, are we ready?
I believe so, New, and we do have Spanish language interpreter here with us. I know I saw Carly mention this in
Fantastic.
the chat, so I'm gonna ask our Spanish language provider to join the room with New, the unicorns. Um, and the the transcription, the written captioning in Spanish, I don't believe we have our provider with us in the meeting. So for Spanish language, please join the unicorn room with New. And I think I'll open the rooms now.
Great. Thanks, everybody. Enjoy the conversation.
I'm here to help anyone. New, you can go into the room that you're with if you'd like.
Do I
Carrie,
have to push a button, Carrie? Oh, sorry, Sarah.
go oh yeah, I can just send you to your rooms if you'd like.
I have a question in the chat about, I heard someone say which tribal option to go to, but I'm not quite sure which one.
Okay, yes. would you please go to our public health unicorns room? We have some other specific tribal partner engagement opportunities that we're working with the tribes on that are outside of this meeting, but inside of this meeting, please join the unicorns room. Thank you.
Okay. Oh, I think, by the way, I work for OHA, so I don't know that.
Oh, okay.
Yeah,
Yeah.
appropriate to go. I might just leave the meeting. So,
Oh,
okay.
you can come into the OHA one. Either one's fine.
Oh, I had the same question because I work for OHA and there's also CBOs. My work is working with CBOs.
Yes,
So
so
I'm
because
confused.
thank you, Noni. Please join the room that you are a part of the workforce of. So if you work for the state, join the OHA Public Health Division room. If you work for a local public health agency, join the local public health room. If you identify as working in a community-based organization, join that room. And Sam, I see you. I'm going to get you into your room.
Thank you.
And Carrie, I'm not sure how I'm supposed to actually enter the room that I'd like to enter. Sorry, you're muted.
I'll help you in just a second.
Oh,
You
thank you.
should have an invitation to pick a room and you join the academic one.
Is the invitation in the chat box or?
It pops up in your features or functions for your Zoom.
Huh, I'm actually not seeing it.
Okay, I'll just put you in it. No big deal.
Thank you.
Yeah. And then
There should
Sam.
also, sorry, Carrie, there should also be an option at the bottom of the screen that says breakout rooms of the little like logos. And normally if you click on that, it will show you how many breakout room options there are. And you
Got
can
it. Thank you.
Find it? Okay, thanks, Heather.
Of course, yeah.
Anyone else need support to find the room for your workforce?
Danita asked where they should go. They work for a tribe.
Okay, please go to the unicorns and Spanish language room. We've got all of our partners for our tribal partners. So just for your awareness, did she already leave? No, you're here, Danita. OHA is doing outreach that is being directed with the tribes. And so we have some upcoming engagement with our public health tribal public health modernization grantees, and then with the tribal public health directors that are coming up soon. And that's all in the slides. So I think everyone will be getting those after the meeting. But if you don't see your specific workforce category listed, whether you're working with academia, education, local public health, state public health staff, or community-based organizations, then please join the unicorns, public health unicorns space.
Gary, quick question for you. I didn't recall news saying how long people are going to be in the rooms. Was there?
They'll be able to see the counter in their rooms, but there's 24 minutes left, so it's 30 minutes total.
Okay. Normally, when we've done breakout rooms in the past, I'm not sure whether that's the plan, but to send out the host sends out an alert when there's 5 minutes left.
Okay, I can do that. Right now it's set for a 60-second timer to let them know, but I can do that in 5 minutes too, with 5 minutes left.
Can we please pause the recording?
Oh, yeah, we can stop the recording.
Okay, I wasn't sure if you were planning.
Hi, everyone. Welcome back. Talk about a fast 30 minutes. I mean, I hope that you had an opportunity to really share some thoughts and hear some thoughts of your colleagues. What I do want to share is that what we'll be doing is for the next steps, There's going to be more opportunities to engage in this information, to share and provide your thoughts. We do have these scheduled engagements on our calendar. We'll be having some meetings with our tribal partners in August, at the end of August. We also have a tribal directors meeting in September. For our community-based organizations, we will have an advisory meeting in September, and we will be meeting with our academic partners in September as well. So we have a lot going on still to be collecting information from you all. For local public health folks and Oregon Health Authority folks, so our workers at our local agencies and our state agency, we do have continuing capacity to collect information. We also have a public health, what they call the public health wins survey that's coming out in September. A lot of different ways that we're collecting information from you all. We do have an anonymous smart sheet form. I mentioned it to my breakout session. So if you clicked on that particular smart sheet form, you'll be able to add those thoughts that you didn't get a chance to share during the breakout session. We know that they were pretty full, lots said and shared during that time. And so I do encourage you to, as you're thinking about, hey, I didn't get a chance to say that, put it down on that smart sheet and submit that. I would also encourage you to reach out to Carrie Christensen, who leads this work. And she's available at any time to connect with you. You can send her a quick email. A lot of this is going to be collected. We're ready to put it into the recommendations as part of it, you know, collate, put it all together and offer it back to the Public Health Advisory Board. And so that's what we're going to be doing with your thoughts and comments today. I want to say thank you to our interpreters and transcribers for their participation today, and then also for our facilitation team. There was a lot captured, and I hope that you felt seen and heard. And I would encourage you, if you want to reach out again, please do so. I don't, let me see. Yep. And I think that's everything. I'll pause. If folks have a quick question or comment, I'm happy to take that right now as well. We do have a couple minutes. And if not, we're just going to wrap everything up. Any last question or comment from folks? I'm looking in my chat real quick. Yes, 30 minutes is not enough. We totally recognize that. We totally recognize that. And most of you stayed, so thank you for doing that. We do know that there will be more opportunities, and so I do encourage folks to seek out those opportunities. And if you know of, if you're in one of those September meetings, please join them. Community-based organization advisory committee. We do have the academic and tribal meetings that we'll be going to as well. So with that, I want to say thank you everyone for this beautiful Thursday morning around our state. Please stay safe from fire and danger out there, and then stay safe from the heat as well. So thank you everyone. I appreciate you all. See you next month.